like, make sounds, or if you call on the baby might respond. So it all depends on the age of the baby. Um, older child maybe playing with a toy, um, looking at you, responding to a toy that you maybe have in your hand. Okay, so it's all about this interaction with the environment and with people. How is the child's interaction with his mother, okay, or the caregiver? How is a child moving, right? So looking at the movements of the baby, is the baby moving all the limbs? Is the baby only moving certain limbs? Okay, so that's kind of really essential. Um, or is the baby not, or is the child not moving at all? Maybe just in the bed, cannot move any limb. Okay, and then is he or she walking normally? So obviously, in children that are able to walk, right, mostly in the old children, um, are they walking at the age that they are, perhaps that they normally have to walk? Okay. um Actually gonna take me to the developmental, but in another live session I'll definitely speak about the developmental assessment when we go on to the neurological examination with children. Okay. Is he or she assuming any abnormal position or displaying abnormal movements? So do you see any position that might be abnormal, or posture that might be abnormal, or perhaps an abnormal movement? Is it perhaps a seizure? Is it perhaps chorea? Okay, depending on the clinical picture that we are seeing. So, or is the baby just on its bed? Okay, is there any muscle twitches, for example? So, first one we spoke about is that, is the patient ill or well, comfortable or uncomfortable, cooperative or agitated or irritable. We spoke about the interaction with the environment and the caregiver. We spoke about moving. Is he or she walking, abnormal positions? I'm thinking we might um, try to develop a certain acronym. Um, so I'm just seeing quickly. So we have I for ill or unwell, C for comfortable or uncomfortable, C for cooperative or agitated, I for interaction, M for moving slash walking, uh, P for position, posture, abnormal movements. Then the last one is the noises, right? Do you hear any noises or obvious heavy breathing? So in some children you can actually see that, okay, there's kind of obvious heavy breathing in this particular child. Okay. And that could indicate certain like respiratory problems. Okay, can you hear any like cough or a wheeze or stridor, right, or anything that could indicate a perhaps a respiratory problem? So I'm gonna just say B for breathing. So the acronym is PIC. Okay, wait. PIC mic, right? PIC, PIC mic B. PIC mic B. Okay, so that is the acronym that we are going to use for the first impressions of the child. Okay, so the acronym for us to remember for the first impressions would be PIC mic B, right? So the P will stands for the position or the posture, or any abnormal movements. Okay. So the P will stand for that, right? So we have P for position, posture, abnormal movements. The I for ill or well, right? So is the child ill or well? We can also kind of branch the ill into acute or chronic. Then we have the C is for the C is for comfortable or uncomfortable, right? And you can actually see in the child, like whether the child is actually comfortable or uncomfortable. Right. So we have the P for okay, then the M for movements. Is the child moving or walking? Okay, I think we can also maybe include the abnormal movements under this category as well. Okay, the other I is for interaction, right? What is the child's interaction with the environment, with the caregiver, okay, and also the interaction with the examiner as well, the person actually examining the baby. Then the next C is for cooperative, right? Cooperative. I know it's kind of usually linked to the comfortable, the ill or well, but because of we're busy with a an acronym, it's kind of quite challenging to group it all together, but it's fine. Cooperative or agitated, and I'm just going to include here as well irritable, right? And then the B is for breathing, right? Any um, breathing difficulty, any heavy breathing, okay? Just want to take a pause quickly. So that's the first part on the general examination. The first impressions, okay? How do I pause this? I don't think. Okay, so that was kind of the introduction to the general examination. Okay, so first of all, you always start with first impressions, okay, of the actual child. I know some people start with the so we're going to describe, yeah. So that's kind of the first impression, and it's all under the bedside context. Okay, so you have the bedside context, right? You get your first impression. After the first impression, we look at hydration and perfusion, and then afterwards we go to anything attached to the child or the bed. Okay, so in the first impressions, we spoke about our acronym which we are using, and that's pick might be. Okay, so pick might be, right? So the P is for posture, any abnormal posture or positioning of the child in right. Then I for is the child ill, chronically or acutely ill, or is the child well? Okay. The C is for is the child comfortable or uncomfortable? The M is for is the child moving or not moving? Is there any abnormal movements? Is the child walking? The other I is for is the child interacting, right? What is the child's interaction with the environment, with the caregiver, with the examiner? The other C is for cooperative. Is the child cooperative or agitated or irritable? And then the B is for breathing. Is there any breathing difficulties? Okay. Just gonna see if I can do that. Oh, it's a little bit. Okay. I think this flash is so bright in my eyes. Okay, there's no way I can. It's fine. Okay, so cool, right? So then now we're going to the hydration and the perfusion. Okay, now when they speak about the hydration, okay, um, this flash is so bright. Cannot actually. Yeah, I think that's fine. Oh, that's a little bit too bright. That's a bit too dark. That's fine. Okay, cool. So that's fine. Okay, so now we're going to the hydration. Okay, now with hydration, is the child well hydrated? Um, the first thing over here that we have is thirst, right? So, I mean, obviously, in all the children, you would probably could figure out is the child actually thirsty. So let's try to figure out an acronym. So T for the thirst, dry mouth and mucous membrane. So you look at the mouth, right? Is the mouth dry? Mucous membrane, look outside. Is it moist? Is it not cracked? Okay, so I think I'm gonna put M for mouth slash mucous membranes, right? Dry mouth or dry mucous membranes. And then tears, right? T for tears, no tears, right? If there's no tears, sign of dehydration. If the eyes is nice and wet, you can see my eyes, you can probably see the tears, a little bit of tear in the eyes. You can see, okay, it means that the child is well hydrated, okay? Then decrease skin turgor. So I'll put the S for skin. Okay, so is there a decrease in the skin turgor? That could be an indication of dehydration. Then another is for sunken eyes. Okay, so you're looking at the eyes. Are there any sunken eyes? Then another is for sunken fontanelle, right? Is the age appropriate? So usually with your neonates, just want to check. Um, when do the fontanelles close completely? So the the anterior fontanelle closes around 18 months. Okay, the one at the back, the posterior fontanelle closes around by age 2 to 3 months. But the anterior fontanelle closes at around 18 months, okay, which is about a year and a half, okay. And then L for lethargy or irritability. Now, if a child is or a baby is dehydrated or child's dehydrated, the child will be lethargic or irritable as well. So I'm going to put the I because we need some vowels, right? The I for irritability, and then we can link the lethargicness to that as well. And then the last one is decreased urine output. I'm going to put a U here for urine. Okay, so decreased urine output is sign of dehydration. Okay, so the acronym for hydration we are going to use is MISTAT. Okay, MISTAT. And there are three S's. Okay, so we are going to use MISTAT. Okay, so we have, just see, okay, so it's MISSSTU 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Okay. So we are going to use the acronym MISTAT. Okay. So the M refers to the mouth, right? Is there any dry, is there a dry mouth or mucous membranes? The I, mucous membrane. Oh, the I refers to irritability, right? So is there any um, irritability or lethargic? Lethargic is for sunken eyes, right? Sunken eyes. We have skin turgor, right? Decreased skin turgor. We have so it's sunken eyes, skin turgor, and the sunken fontanelles, right? Sunken fontanelles. T for tear production. U for decrease in the unit output, and T for thirst. Okay, increase in thirst. And I'm gonna put it last because that will probably be kind of the last feature for hydration. All the other signs could basically lead to an increase indication that this child actually has dehydration. Okay, so I'm gonna take a break after this, but I just want to recap on the general approach when you approach a child. Okay, so first of all, you look at the first impression, right? So with the first impression, the acronym that you are using is PIC might be, and the P is for posture or the position of the child. The I for is the child ill or well. C for cooperative or uncooperative. The M for is the child moving or walking or any abnormal movements. The other I for interaction, right? The action with the environment or the caregiver or examiner. The other C is for is the child uh, comfortable or uncomfortable. And then the other B is for is there any breathing difficulties or heavy breathing, right? Or any noises that you can see. And there's many other signs, but we'll cover those other general signs specific to certain systems that we are going to actually cover. Okay. Now, the next step after the general impression. So once you have that general impression of the child, we then go into the hydration and the perfusion status of the child. So yes, you say the child is well hydrated, but what are the cardinal features that you are assessing that this child is well hydrated and not dehydrated? The acronym that we came up with now is MISTAT. Okay, so the M is for dry mouth and mucous membranes. So I'm speaking about now the signs of dehydration. So dry mouth or dry mucous membranes. The I for irritability or lethargy, lethargy or being lethargic. The S for sunken eyes, the other S for sunken um, anterior fontanelles or anterior and sunken posterior fontanelles, and the other is for decreased skin turgor. Okay, and then the first T for TAT, the first T is that of a decrease in tear production, the U for decrease in urine output, and the last T is that of an increase in thirst. Okay. In the next session, I would like to speak about the how to assess with the perfusion of children during this introduction into the general exam, and also like what things in the environment that you need to look for while doing this general examination. Okay. Thanks everybody, and I'll see you in the next live. Peace.